So for weeks now, we've been hearing about how grave the situation is for children in Montreal emergency rooms with the trifecta of COVID, the flu, and RSV. And now there are reports of children dying of the flu in British Columbia, as well as an outbreak of Strep A resulting in 15 children's deaths in the UK. So Montreal Public Health is closely monitoring the situation here. Dr. Jesse PAPENBURG is an infectious disease specialist at the Montreal Children's Hospital, and he joins us now. Thank you for your time today, Dr. PAPENBURG.
That's my pleasure.
So let's start with Strep A. What exactly is it, and how big of a concern is it here in Montreal?
Right. So Strep A is the most common cause of a bacterial sore throat. So that's the common strep throat. So as you can imagine, there are a lot of strep throats. It happens a lot every year. There's an increase during the winter time. And the vast majority of these will improve faster with antibiotics, and the antibiotics also reduce the risk of complications. But even those that don't get treated actually will resolve on their own eventually as well. But in a very small proportion of cases, you can get what we call an invasive streptococcal infection. And that's what we've kind of got our eye on right now, where under the right circumstances, perhaps because it's a Strep A strain that's a bit more aggressive, or there's been a recent viral infection that kind of allows it to enter and invade either directly and causing like an abscess. It can cause an abscess in the neck muscles or in the throat. It can get into the blood, which is more serious. Obviously, Strep A pneumonias are very serious as well, or it can cause something called toxic shock syndrome, where it releases a toxin and a person's blood pressure can drop quite quickly. And finally, perhaps the other manifestation that people may know about is the so-called flesh-eating disease or necrotizing fasciitis, where it's a surgical emergency in order to stop the spread of that infection. So these are all very ominous and scary manifestations and quite serious. But I think it's important for people to understand that they represent a really tiny fraction of Strep A infections. But as you mentioned, we're getting some signals from different parts of the world, including France, the UK you mentioned, even anecdotally in the United States, that there's an increase of these more serious strep infections. And it seems to be associated with this, viral wave that everybody has experienced, or at least many people in many countries in the northern hemisphere have experienced. And we know that these respiratory viral infections can predispose somebody to a severe strep infection as well. Now, in Canada, I haven't seen any official systematic data either from a Quebec perspective or from a national perspective. I want to let everybody know that it's something that is a nationally reportable disease, notifiable disease, so we keep a close eye on it from a public health perspective. I don't know the data yet, but anecdotally speaking to other colleagues either at St. Justin or across Canada, we all kind of get the feel that we've seen more children hospitalized with a serious strep infection in the last few weeks. So it's something that we're monitoring very closely.
Okay, and I mean, I guess history tells us that what has happened in Europe tends to then make its way here. It always sort of seems to be a matter of time. So do we need to be kind of bracing ourselves for there to be worse situations to come?
It's difficult to say. I think everybody's crystal ball is a little bit cloudy these days because of the way that the COVID-19 pandemic has, it has kind of upended a lot of the typical seasonality we see with different respiratory viruses and other infections. So I would say that I don't know if we need to brace ourselves, but I think that clinicians already are getting a sense that there is an increase in strep infections, and I think that perhaps one thing I would, that public health can say to clinicians is to have a lower threshold to investigate for strep throat and serious strep infections and to treat them early and aggressively.
What do parents need to know? What should we be on the lookout for?
Right. So again, I don't want people to be alarmed the second somebody gets a sore throat, because a sore throat is a common manifestation of all these viruses that are circulating, right? So I think we don't have to panic, and invasive strep infections remain a rare event. But what should make you think about strep throat as opposed to another infection of the upper respiratory tract are things like the fact that with a cold, yes, you can get a sore throat, and tends to start off with a bit of a sore throat, but then the sneezing, the congestion, all that kind of predominates. Whereas with a strep infection, especially if it's associated with a prior viral illness, is that you might have those cold-like symptoms at first, but then it's the sore throat that really comes on as the main symptom and persists and gets worse. So that's when somebody should see their physician for a sore throat. Not immediately as a sore throat comes on, but if it's getting worse and there aren't any associated now congestion, upper respiratory tract symptoms, if those have faded away, then that's an indication that they need to get their throat examined. And then the more worrisome signs are you can have something called scarlet fever with a strep infection, which is a high fever with a rash that's pretty spread over a lot of the body, and it has a kind of a sandpaper type of appearance too. So if you have high fever and a rash, that's another indication to see a physician. And then finally, obviously, if your child is really not doing as well overall and you find that they're not responding to Tylenol or Advil, they're really just not doing well, that this could be a manifestation of any sort of severe infection, whether it be viral or bacterial, and it would be warranting an investigation or a visit to see a physician.
Okay.
Wow. As I hear you say that, obviously parents want to be able to not have to go to the emergency room if they don't have to. So I will just ask, and maybe I didn't understand this, if you have just a sore throat, that's not an indication to go. At what point into an illness would that, if it continues to be an issue, be the time to go?
Yeah, that's a great question. I guess what I was trying to say is that because all these viruses that are circulating can cause a sore throat, we don't need to jump on every sore throat to have them swabbed and investigated, right? I think the point is if you are having really where the sore throat is the predominant symptom, and often it's also associated with painful or swollen lymph nodes just under the jawline or in the neck. These are signs that are more typical for a strep infection, especially if, as I mentioned, it's not associated with other cold-like symptoms. So if the sore throat is really the number one symptom and you find that it's getting worse, that's something that warrants getting taken a look at.
So helpful.
Hope
Thank
we
you
can
so
help.
much.
Yeah. Thank you so much, Dr. PAPENBURG. Appreciate it.
My pleasure.